Hello, everyone, and welcome. Your presenters today will be Janelle and Rachel from IQUBA, and we will be presenting your plan year 2020-21 benefits in this presentation.
This is our 18th annual open enrollment, so we're really excited to have all of you here. On the screen, we have displayed our other member institutions, so you guys are not alone with this open enrollment period. Beginning next week, you will have the opportunity to step through your enrollment, and you are going along during this period with the other member institutions shown here. So thank you very much for being part of IQUBA.
First off, we'll give you a sneak peek of what we'll be reviewing today. On the left-hand side, what's new for April 2020. We have a low increase on the medical premium. We are introducing new IQUBA Group AFLAC benefits, the critical illness, hospital indemnity, and accident plan. We will also discuss some Rally program enhancements with the introduction of the physician results form. We'll talk about the flexible spending account increase and the limits therein. We'll also review dependent verification and how you can either review or update your personal email address and phone number to be entered into a sweepstakes for a prize. On the right-hand side, we'll also be reviewing some of the same great benefits that you currently have. IQUBA has the best in access to care by way of the single sign-on, Surgery Plus, Teledoc, IQUBA Cares, our health management resources, the Blue Cross and Blue Shield mobile app and tools, as well as our employee assistance program. And then we'll also do an overview of your Blue Cross and Blue Shield medical plans, the OptumRx prescription plan, Aetna Behavioral Health, Humana Dental, iMed Provision. We'll review your Mutual of Omaha life and disability plans. And then to finish it up, we'll discuss some of the open enrollment housekeeping items.
So as we mentioned last year, IQUBA is a self-funded medical plan. What this means is that IQUBA pays all the claims that are processed by our medical, pharmacy, and behavioral health benefit managers. The benefit managers are the forward-facing companies to your doctor's office. You obviously present your Blue Cross Blue Shield ID card. However, the larger bill is paid by IQUBA. So all those claims are paid for by your premium dollars and the reserves that we've built up over the years. Your premium dollars are used for the exclusive benefit of our members, and we only use your premium dollars on your benefits, so the claims that you guys are, the benefits that you guys are receiving in the doctor's office and through you picking up your medications and such. Our plans are specifically designed by educators for educators. We meet monthly in Orlando to talk about what's working well and what could use a little bit of help. And one of the big positives that came out of those meetings this year are the enhancements to our Rally program, which we'll talk with you about. IQUBA does invest in a long-term culture of well-being so you can be the best version of yourself. And thanks to you for using the plan appropriately and being mindful when using the plan last year, we're able to bring our members a low increase for the 2020-2021 plan year.
First up, we want to discuss some of the new group AFLAC benefits. We are offering new this year critical illness, hospital indemnity, which comes with a low and high plan, as well as an accident plan. These new plans will provide you with better benefits at a lower cost in most cases. Guaranteed issue will be offered during this open enrollment, which means no medical questions will be asked. And then if you do have a prior individual AFLAC plan through your payroll deduction, those through the individual plans will no longer be offered. If you are still interested in keeping those plans, portability is an option, and any portability information will be mailed to you if you choose to keep your prior plan.
First up, we have Group AFLAC, the critical illness option through IQUBA. This is a brand new offering this year. So the coverages included under the critical illness are listed on the left-hand side. Cancer, including invasive, non-invasive, and skin cancer. It also includes heart attack, sudden cardiac arrest, coronary artery bypass, major organ transplant, bone marrow transplant, kidney failure, and stroke. There are features of this critical illness benefit is it pays a lump sum cash benefit to you upon diagnosis of the items outlined on the left-hand side of the screen. This benefit pays in addition to other insurance coverage, and we are offering guarantee issue up to $30,000 this year for the employee and up to $15,000 this year for the spouse. When you're making your elections, you just need to be mindful that the spouse election cannot exceed 50% of the employee election. Just something to note, children are automatically covered under the employee's election to the age of 26. So there's not a separate election for children. They're automatically covered under the employee's coverage. For all three of the AFLAC coverages that we're going to be talking about, portability is available. So if you can take the coverage with you if you change jobs or retire at any point after electing the coverage. The critical illness does come with an added benefit. We hope that you do not receive a diagnosis listed on the screen this year. And in the event that you don't need to receive a lump sum cash benefit, there still is an annual screening benefit that is available to you, which will pay you $50 just by going to your annual doctor's visit.
Up next is the Group Hospital Indemnity Plan. This plan covers hospital admission or confinement due to an accident or illness. It pays a lump sum cash benefit to you. This does pay in addition to other insurance coverage. As Rachel mentioned, you are able to take this with you if you change jobs or if you retire. Premiums are payroll deducted. And again, no medical questions will be asked at this time. We mentioned previously that there are two levels, a high and a low plan. And so we've outlined here on the screen the benefit coverage levels. Under the high, for an admission, it's $1,000. Confinement, $100. And intensive care, it's an additional $100. Under the low plan, admission pays $500. And then that confinement and intensive care are both $100. We did want to provide you with an additional example of how this benefit would pay out. The example we put is the most common claim, which is for your pregnancy delivery. Under the high plan, for an admission, again, you're paid that lump sum, $1,000. You're in the hospital for 3 days. That's an additional $300 for a total payment to you of $1,300. Under the low plan, the admission would pay $500. Again, the confinement is $300 for a total payment to you of $800.
Finally, our last group AFLAC offering is the accident insurance. Nobody really plans for an accident. That's why we call it an accident. But we just want to make sure that your finances can handle such accident if it should occur. So you can get reassurance from this plan to help you cover expenses such as an ambulance ride or emergency room visit if you happen to fracture a bone or you get a severe burn or laceration. These are all items that would be covered under that accident insurance. Just like with critical illness, we hope you do not need to cash in on this benefit this year, but there is an added benefit to you for an annual health screening where a $50 benefit would apply to you.
Okay, up next, we're going to discuss the Rally program enhancements for the plan year 2020-2021. Again, for this year, to start off, that gatekeeper will still be the Rally survey. So make sure you complete that survey. You will not see any of your Rally dollars on your Rally portal unless you take that survey first. As far as our enhancements, the wellness exams, the incentive is $60 this year, up from currently it's $25. The biometric screenings will be increasing to $40. Again, that's up from the $25 that it currently is at. For our on-site and campus events, those have increased as well. We still have a $10 incentive for each, but now you can earn up to $70. For your preventive exams, your PSA colonoscopy, and mammograms, you'll still receive a $50 incentive that's rewarded for your first claim processed. You can still earn the incentive for an IQBA Cares qualified medical change of $50. And then we have some unlimited coins on both your missions and city challenges. As well as the coins, IQUBA does do a private sweepstakes for those challenges that we'll discuss later. You also have teledoc registration, and if you tobacco attestation program, those both earn you $400 Rally coins. And then we have the clinical rewards program, again, that we'll discuss later. You can earn 500 Rally coins per quarter for a total of 2,000 coins per year. And then as far as the coins are concerned, we did just want to address it. We do know we have a lot of folks that say the coins aren't worth anything, but a fun fact, IQUBA members donated more than 4 million coins to charities last year. So kudos to the IQUBA members for donating. And then also for the coins, one big thing to keep in mind, Rally does have some flash sales with some really deep discounts on health and wellness items, travel discounts, discounts to Disney. So just make sure that you keep an eye out for those flash sales to use your coins for as well.
We're really excited this year to introduce the physician results form. We've been asked for several years now, when I'm at health fairs, I just got my blood work done at my doctor's office, how can I submit it? Well, in the past, the answer has been, I'm sorry, you have to go through the on-site process as well. Beginning in April, you will no longer have to get an additional finger prick or an additional blood draw because you can submit the blood work that is done in your own physician office. The steps are outlined on the screen for completing that physician results form after April 1st of 2020. So you will visit the same website that you currently are visiting to set up an on-site event or schedule an on-site appointment, or to visit the Patient Service Center. After April, there will be a new box for you to check, also indicating a physician results form. So from there, step 2, you'll simply download the form. The form will contain a barcode, which is specific to you as an employee or to your covered spouse. So it's important that you not make copies of this form or share this form because it is tied to you with that individual barcode. Step 3 is just completing your annual wellness exam with your physician, where blood work is also done, and your physician will simply fill out the part of the form that is circled in red and with your biometric items. And then step 4, the final step, is submission of the form. So your physician can always fax the form to Quest Diagnostics directly. The phone number is at the top of the form, but we know how doctors' offices can be a little crazy sometimes at the front desk. So we're just encouraging all of the members to do your due diligence, request a copy of the signed form so you can take matters into your own hands and either fax or upload the form to the Quest portal on your own. The second option is definitely encouraged, especially if your dollars are not received, in a reasonable amount of time following the biometric. But we're really, really excited to introduce this new option. Our members have been asking for something like this for a long time, and we hope that you guys are excited about this as well.
Next, we wanted to talk about Emma. Most of you are familiar with Emma if you've ever gone through the open enrollment process or just enrollment in general. So we wanted to provide an Emma and just kind of break down how these benefits work and how you don't have to do much to just earn dollars and get the most out of this program. So we'll first start with Emma's story, and we hoped that next year, this time, this will be Emma's story. So Emma downloaded the Blue Cross and Blue Shield mobile app, and she was able to locate a Blue Distinct Total Care provider. She went to that provider and got an annual physical. Of course, since it was a BDTC, we know that visit was free, and just by doing that, she earned 60 Rally dollars. Her primary care physician submitted that physician's results form to Quest, earning Emma an additional $40 for her biometrics. And just by going to her BDTC for her annual physical, Emma has already earned $100. At work, Emma also had the opportunity to participate in 5 on-site events totaling $50. She's hoping to do 2 more before the plan year ends. During her recent doctor's appointment, Emma was diagnosed as diabetic, so she connected with a health coach through the Rally Clinical Rewards program to help her control control her condition. So to date, Emma has earned 150 Rally dollars, and she's donated 8,000 coins to various Rally charities. So we just want to provide you with an example here of Emma. She hasn't done much. She's went to one doctor's visit, and she participated in some events where she didn't have to go anywhere. They were already on site on her campus, and she's earned $150. Very easy to participate in the program and get something out of it. So we just hope that you all imitate Emma and make sure that you're getting your physicals, your biometrics, and taking care of yourself.
Just some Rally reminders. Clinical Rewards is still available for chronic conditions. So if you have been diagnosed with one of these chronic conditions that are included in the program, listed on the screen right here, all this means is that your Rally homepage will have some additional educational material for you. If you complete these educational steps, reading articles or connecting with a health coach, you do have the ability to earn 500 Rally coins each quarter or up to 2,000 Rally coins each year. On the other side of the screen, we have city challenges and private sweepstakes. We're highlighting the city challenges first and foremost because that is where you sync your mobile device or your tracking device. And every 14 days, when you hit a milestone with your tracking device, you're automatically entered in to win a sweepstakes. And then every 14 days, we are giving away a $50 Amazon gift card for those city challenge milestones. In addition, we have other private sweepstakes that are linked to the other challenges. I know that there's water challenges out there or sleeping challenges, and then we have the missions that are always fun and also for completing your annual survey.
Another way IQUBA breaks down your barriers to care is through single sign-on to our various brand partners. These single sign-on links can be found on IQUBAbenefits.org on your home page. There is a scrolling picture banner directly under that banner. There's a section called My Carrier Accounts. And so depending on which plans you're enrolled in, you'll have these single sign-on links to your IQUBA Benefits MasterCard, the Optum RX prescription portal, the Blue Cross and Blue Shield My Health Toolkit portal, Aetna, Humana Dental, as well as the iMed websites. And so these are quick and easy ways to access your benefits. You can access this on your web browser or on a mobile browser. And so just by clicking on these links, when you do click on the link, for the first time, you will be on some of the sites required to register and create a username or password. But then going forward, as you click on those links, you'll be directly logged into those accounts and have instant access to all your benefits, your claims. You can order cars and do multiple things there from these single sign-on sites.
So where will you go to make all of your elections during this open enrollment? During this time frame, beginning on Monday, you will visit IQUBAbenefits.org. From here, you'll have the opportunity to review and confirm all of your benefits for the upcoming plan year, which will begin on April 1st, 2020 and run through March 31st of 2021. Your open enrollment elections will remain in effect until the end of the plan year. This is not an IQUBA rule or a St. Stephen's rule. This is actually governed by the IRS. Any other changes that you need to make during the plan year can only be done within 30 days of a qualified life event. So when you get to your home screen, you'll just click on Start Your Enrollment, and then from there you can proceed through the enrollment steps using the orange Continue button until you get to your final view, email, or print your enrollment screen, letting you know that you've completed it. If you do shut Emma off at the beginning, like most people do, she asks a lot of questions and she talks a lot, so we understand if you shut her off. Just a reminder that if you need her, again, for any reason, she will be available in the enrollment process.
Dependent verification. So dependents who are not eligible must be removed from the plan during open enrollment. If you do have an ineligible dependent, that coverage will terminate March 31st of 2020. So who is an eligible dependent? An eligible dependent is your legally recognized spouse, your natural child, your legally adopted child, your stepchild, a child required to be covered pursuant to a qualified medical support order, a child with proof of legal guardianship who resides with you, and a foster child. Just keep in mind that a child is a dependent until the end of the calendar year in which they turn 26. And then if you do have a dependent who is over the age of 26 years old and they're disabled, which means they're continuously incapable of self-care, because they are disabled, we do allow them to continue to be enrolled under the plan after the age of 26. During your enrollment process, you will be asked to certify that the dependents you are covering are eligible. And if for some reason you do have any ineligible dependents, just keep in mind that you will be liable for the full cost of benefits paid, plus any investigation and attorney's fees for any ineligible dependents. So very important to keep that in mind this year.
We are just reminding you that flexible spending elections are required each year. So your health care and dependent care flexible spending accounts will not roll over from prior years. Both of these accounts are funded by you, the employee. They are both deducted pre-tax throughout the year. And just a few highlights on the health care flexible spending. The health care fund, the health care amount that you select during open enrollment, the full amount will be available for immediate use on April 1st of 2020. The healthcare flexible spending can be used for healthcare expenses for you and any eligible tax dependents. If you're enrolled in an IQVIA medical plan, the healthcare flexible spending funds will be used prior to dipping into your HRA funds, since those HRA dollars will roll over. There is a new IRS individual limit. The limit went up by $50, so you do have the ability to put away $2,750 this year on a pre-tax basis. And then on the middle column, the dependent care flexible spending account, these funds are also deducted pre-tax and can be used for daycare, aftercare, summer camps for dependents up to the age of 13. So just a reminder, if you have a dependent that will turn 13 in the middle of the year this year, just make sure that you're taking that into account when you're budgeting. The IRS calendar year household limit is up to $5,000. So if you're not going to use that full $5,000, that's just something that you need to plan for. Both of these healthcare and dependent care flexible spending accounts are both set up as use it or lose it accounts with no annual carryover. So it is incredibly important that you plan wisely and you don't over budget for both of these. Just as an FYI, your HRA is paired with your IQVIA medical plan. So if you enroll in an IQVIA medical plan, you will automatically receive funds into your HRA account, which will also be loaded onto the IQVIA MasterCard. These funds are from St. Stephen's School, so thank your employer on the way out of your meeting today. These are not deducted from your paycheck. These funds are available at the end of each month, and they do earn quarterly interest. These can be used for eligible healthcare expenses for participants that are enrolled on the IQVIA medical plan. So that's one of the differences between the flexible spending. You must be enrolled in the IQVIA medical plan in order to be eligible for these funds. These funds can be used for all healthcare expenses, including dental and vision as well, but the kicker is that you must be on the IQVIA medical plan. The funds do roll over every year, and after 36 months of continuous enrollment in an IQVIA medical plan with an HRA, you are what we consider vested, and the funds are yours to keep should you ever leave St. Stephen's.
Next up, we just wanted to highlight our open enrollment sweepstakes. So during open enrollment, of course, you'll log into IQVIAbenefits.org. Through that enrollment process, you'll be asked to update or confirm your personal phone number and your personal email address. Once you finalize your enrollment, you click complete, you will be automatically entered to win. So just make sure you take a look at pay attention, to that part of your enrollment. We do use that information when we're trying to contact you, or if you have mail or anything returned, we'll generally try to contact you by phone or email. And then, of course, the bonus, you're entered to win a prize. So we just want you to make sure that's available and that you pay attention to that during your enrollment.
So we've got some good news. All the logos or icons that you see on the screen will not be receiving changes to their plans this year. All the brand partners will continue with their existing plan offering.
So improving the access to care by eliminating those barriers. It's important, we think, for you guys to be educated healthcare consumers and understand how your plan pays for covered services before you actually get to your doctor's office. So the IQUBA medical, prescription, and behavioral health insurance plans are specifically designed to remove those barriers to care. We meet once a month with representatives from each of our schools, and we work really hard, and we really do hear you guys. And so we want you to keep that in mind as we review some of these benefit plans for the upcoming year.
This slide is just a snapshot of, just to give you kind of an overview picture of how our plans work. In the left column, these benefits have no cost to access the benefits in the left column. So all of the benefits on the far left will always be free to you if you're enrolled in an IQUBA medical plan. Starting with the blue distinction total care, as you know, all visits to a primary care physician are always free. That also goes for colonoscopies, any immunizations, mammograms, any medically necessary labs performed at Quest Diagnostics, and a multitude of other items are at zero cost to you. In the middle column, these are items that do not apply to your deductible. So for the middle column, you will have a copay or a co-insurance in most cases, but for items like advanced imaging or chiropractic services or ER or emergency transportation, physicals, prescription drugs, or therapy visits, none of these will ever be subject to your deductible. So it's just important that you understand how your plan works before that you visit the doctor's office. And then on the far right-hand column, these are the major services which will always apply to your deductible first. So items like durable medical equipment, any hospital stays or hospital visits, any inpatient mental health or substance abuse treatments, any private nursing or private duty nursing, and these more major services will always be subject to the deductible before the plan will pay. So just really make sure that you understand how the plan works so you can brace yourself with the information that you need to be a really good advocate for yourself.
Next, we'll review your Surgery Plus benefit. This is also paired with your medical plan, so you do not need to make a Surgery Plus election. If you're enrolled in medical, you're automatically enrolled in this benefit. So with this program, you have access to Surgery Plus's elite Surgeons of Excellence network, and the surgeons are licensed, they're board certified, fellowship trained, and they've been screened for malpractice, sanctions, and criminal records. We did want to put just a few of the covered surgical procedures. These are just some of the most common ones listed there on the screen for you. A knee replacement or a knee repair, your shoulder, foot, and ankle, your spine, or bariatric surgeries. So if you go to your doctor and they've said that you need surgery, you can get in contact with Surgery Plus. There is a financial incentive for us as well. If you are having your surgery through Surgery Plus, your deductible and co-insurance are waived, so your procedure is at no cost to you. There is also a travel benefit included if it applies to you. So once you've been told you need surgery, the number's there. You can give Surgery Plus a call, and they have full concierge service. So you call and you have access to a dedicated healthcare advocate who's with you throughout your entire journey. They can help you locate the best surgeons to fit your needs. They schedule your appointments. They coordinate all your travel, transfer of all your medical records, and they'll also schedule follow-up visits if necessary after your surgery. So just please keep this in mind this year. If you or one of your covered family members are told that they need surgery, it might be a good idea to look to Surgery Plus first.
Just a reminder, all primary care visits to a Blue Distinction Total Care primary care physician in a family practice, internal medicine, or pediatrician office are always free. So whether you're visiting for a well visit or a sick visit, as long as they are considered a primary care physician and they have this designation, every visit should always be free. So if you're in the market for a new doctor, we would encourage you to look for a Blue Distinction Total Care provider. On the other side of the screen, we are highlighting Care Connected. This is actually just a fancy way of saying customer service. So this number is listed on the back of your Blue Cross Blue Shield ID card next to the Blue Cross Blue Shield customer service. They can help with claims questions. They can assist with billing. They can even assist when finding a Blue Distinction Total Care provider. They can also connect you with a lifestyle coach or chronic condition coaching. We introduced Care Connected a few years ago. This is the tailored specialty group of customer service representatives that are available to help you with whatever you need when it comes to Blue Cross Blue Shield.
We also wanted to review with you and just highlight as a reminder that Teladoc is still available to everyone for a $5 copay. We do have single sign-on to Teladoc through the Blue Cross and Blue Shield My Health Toolkit. So you get the telemedicine or video consultations available anytime with a licensed physician. If your doctor's not available, you don't have time, you're at work and you can't get away, or you're on vacation or a business trip, you might want to consider Teladoc. If you're seeking to get a Teladoc appointment, we always just suggest that you establish your account prior to seeking treatment. No one ever wants to answer any questions or register when they don't feel well. Your company key is always IQVA, so keep that in mind as you're registering. Teladoc physicians are a national group of NCQA qualified physicians that have contracted with Teladoc. We did want to list some of the top diagnoses here on the screen. Pink eye, sinus problems, ear infection, nasal congestion. You may think you have the flu or allergies. Consider Teladoc for that $5 copay. They can also charge that copay to your IQVA Benefits MasterCard directly. And also just keep in mind that no controlled substance prescriptions, psychiatric prescriptions, or lifestyle drugs can be prescribed by these doctors. So you do want to make sure that you are keeping that ongoing relationship with your primary care physician for those needs.
Next, we are going to review IQVA Care's Pharmacist Advocate Program. So if you have experienced side effects with a new medication, or you simply have questions about a new medication that you're starting, if you were recently denied at the pharmacy for a prior authorization and you've misplaced your letter from Optum, if you were told that you need to try step therapy before taking a certain drug and you're not really even sure what step therapy means, or if you simply just want to learn how you can save money by switching to a generic. These are all really great reasons to call the IQVA Cares Pharmacist Advocate Program. They are available Monday through Friday during normal business hours. So they are real pharmacists that will really advocate for you, and they'll get on the phone with your doctor's office or the insurance company and help you iron out some of the issues that you're having and really provide real solutions to you. So if you've not called IQVA Cares for a prescription checkup, we encourage it.
Next, we just wanted to review our health management and care consultants. These are trained health advisors and registered nurses that can provide you with tools and education. They can also advocate for you to help you manage your chronic conditions. So if you do receive a call, I know we all hate answering calls from numbers we don't know, but if you do receive a call, they're calling because they care. They can help you set goals, help you understand your doctor's treatment plans. If you have any referrals that you're unsure what to do, they can help you with that. They can help you transition care, address gaps in your care, for instance. So if you do get a call from any numbers, and they can be Blue Cross, Optum, IQVA calls, or Aetna, we do encourage you to just take a listen to what they have to say, because it might be important or relating as we mentioned earlier, to something, say for instance, like a prior authorization on one of the medications you're taking.
Just to review the Aetna Able To program really quick, at a high level, this is a condition management program. It helps target the conditions that are outlined on the left side of the screen, whether it be health or life conditions. The program is provided either through web-based video conferencing or telephone. You'll meet once a week with a therapist and once a week with a behavior coach. It is 16 sessions for a total of 8 weeks of engagement. On these calls, they will address the emotional challenges and help you identify health goals and develop an action plan. This is not only over the 8 weeks. The skills and ideas and goals that you learn during this Able To program will help you for the rest of your life.
Next, we want to review another benefit through Aetna is the behavioral health and substance abuse benefit. Here on the screen, we have some reasons why you may be calling Aetna Behavioral Health. Professional counseling. You can speak with a licensed clinician to help you manage a diagnosed behavioral health condition. You can do that over the phone, televideo, or in the doctor's office. We also have psychiatric medication evaluations that are available for medication management of your diagnosed conditions. Applied behavioral analysis therapy. This is really behavioral health services associated with those on the autism spectrum. And then intensive services are available also for hospitalization, detoxification, and residential treatment. Just keep in mind for those intensive services that prior authorization is required. And so there's the number here on the screen. That number is for both the Employee Assistance Program, or EAP, that we mentioned earlier, as well as here on the screen, the behavioral health benefits.
So just to review the EAP, these are the top reasons why you might call the EAP, the Employee Assistance Program, at Resources for Living. If you have an emotional situation, if you need some additional counseling or just somebody to talk to you, you have the ability to tap into 6 free sessions per issue per year. And this is for you as an employee of St. Stephen's, and it's also available to every member of your household. One of the cool things about the EAP program is you do not need to be enrolled in the IQBA plan, and you do not need to even be benefits eligible. This is available to you and all members of your household simply by working for St. Stephen's. They can also help you with various life situations. If you need to obtain a referral or service, like if you need somebody to come mow your lawn, they can help you, link you up with people to help you just in your everyday life. Legal services is another popular reason why people contact the EAP. You can gain access to legal documents and just get legal advice on a wide variety of different topics, including ID theft and prevention and many other things. With tax season coming up, financial is always at the top of everybody's mind during the tax season. So you can always request a consultation with a financial specialist regarding budgeting and especially your taxes, considering that it's the season. But just as a reminder, they do a lot more than is listed on the screen here. So if you have any reason or you need any assistance with anything in your day-to-day life, I would encourage you to contact the EAP. And every call that is made to the EAP is always free and confidential.
Next, we wanted to go over another EAP benefit, which is Talkspace. So Talkspace is an online therapy platform that makes mental health care more convenient and accessible by connecting users with a licensed therapist via text messaging. So on average, 1 week of Talkspace messaging equals 1 EAP session. You can send unlimited text, audio, pictures, and video to a therapist via your computer's web browser or through the Talkspace mobile app. You can expect to hear back from the therapist within 1 working day during business hours for 5 days a week. For this program, you do have authorization is required, so you do have to give them a call and to get the authorization. Once you are authorized, you can just register at Talkspace.com/RFL. When you're registering, just make sure that you'll be asked to put your organization or your school's name there. This is only available, unfortunately, to adults who are over the age of 18. For those who are under 18, you may want to consider some of the other benefits that we've talked about recently. And then we do have, again, the Resources for Living number here on the screen. But again, it's the same as your EAP and behavioral health phone number.
We also wanted to quickly give you a snapshot of all the mobile apps that are available to help you break down barriers to care. I have a special little iCuba folder on my phone that contains all of these apps. So we want you to brace yourself the information so you can help yourself on the go, because again, nobody knows why you're at the doctor's office better than you, or what prescriptions you're picking up better than you. So we just want you to be braced with the information to be a really good advocate for yourself.
And then we also just wanted to highlight the Blue Cross and Blue Shield My Health Toolkit app. They have made some updates to the app last year, but we did just, again, wanted to review and highlight them with you. That mobile app is available through the Blue Cross and Blue Shield My Health Toolkit app in your app store. One of the good features of it is that you can save your ID card to the home screen on that app. So if you're in a doctor's office or you're on the phone with a new doctor trying to make an appointment and you can't reach your card, you can always pull up your phone and go to that My Health Toolkit app. If you save your ID card to your home screen, then you don't need to log in. You simply click Blue ID card and it will pop up there for you. You also have the ability, I don't know with Android, with iPhone, you can save your various insurance cards to your Apple Wallet. This app does come with Touch ID and facial recognition for login, so that provides you with ease of access. You have a million usernames and passwords, so sometimes it becomes very hard, especially as we get up in age, to remember all those passwords. We did want to also just highlight some of the features of the apps. You can pull up, again, your ID card. You can look at your claims, your benefits information. You can find providers and much, much more. You'll get your real-time data if you're in a doctor's office and they're saying you owe $110, but you pull up your app and it says you only owe $20. So it's a real, you can confirm your benefits real time. So we really hope, not just this one, but all of our apps, that you really do take advantage of all of the tools and all the resources that you have available to you.
Next, we just wanted to provide a snapshot of the medical plans offered through iCuba. This is just a quick snapshot of the in-network benefits only and a side-by-side comparison. Again, these plans are not changing for the coming plan year, so they're the same plans that were provided last year. One item to note is the deductible on the preferred PPO and Premier copay plans, as well as the out-of-pocket does match, and that $4,000, $8,000 is higher. So just be aware of the plans when you're making your selection.
And so we also wanted to highlight a few differences, especially as pertains to that $4,000, $8,000 plan. So this plan was really designed with families, with healthy families with children in mind. This plan allows you the freedom to choose the plan you want that meets your particular family's health and financial needs. You can shop for prices for services. You have the freedom to visit the providers of your choice. On that $4,000, $8,000 plan for this upcoming plan year, there is also a $0 increase for the children and family tiers. Some of the differences of this $4,000, $8,000 plan, as Rachel mentioned on the previous slide, the deductible and out-of-pocket are significantly higher than other plans. The co-insurance and co-pays may be higher. The premiums for this plan are going to be much less, but just keep in mind it's for healthy families. So if you experience a catastrophic event, it may end up costing you more. But as far as your core benefits, you still have those same great core benefits that don't apply to the deductible, same well-being incentives through Rally, and the same prescription drug and benefits.
The iCuba prescription drug plan is not changing. It is still the tiered structure that we've had for the past couple of years. It is also available in a 30-day supply or a 90-day at retail or mail order. Just a reminder that a 90-day supply will really save you money. So if your prescription is eligible for a 90-day supply, we really encourage you to fill the 90 days. Just a reminder that we do offer a lot of prescription drug freebies. So if you're on diabetic supplies or you're expecting a baby, these are certain things that are covered at no cost to you. So just be familiar with the plan and make sure that you have a prescription from your physician. You can go straight to the pharmacy counter and get those at no cost. As a reminder, we do have a separate prescription drug out-of-pocket maximum. This is built to protect you if you are a person that takes a lot of prescribed medications, but you might not go to the doctor very frequently. This out-of-pocket is to protect you in the event so you don't overspend.
We have here on the screen for you just a listing of the medical monthly employee plan premiums. Just for your review, just wanted to highlight the HRA contribution that your employer is generously providing to you there as well. So depending on the plan and the medical tier, we just wanted to include these plan prices here for you.
The Humana dental option is also not changing. You have a plan year maximum of $2,000 with a $50 individual deductible and a $150 family deductible. It does cover basic preventive and major services, and it also includes orthodontics. So this plan is not changing for the coming year.
Next is the iMed Vision plan. Again, the base plan is not changing at all this year. We just wanted to highlight a few features of the plan. The frames you get once every 24 months. And then you have on your frames, there is a $100 allowance. And then for your contacts, there's a $100 allowance as well. But again, this plan is not changing.
St. Stephen's does provide some income protection benefits for you through Mutual of Omaha. So the same benefits with no rate increase for your life insurance and your long-term disability.
For your life and disability, we did just want to highlight evidence of insurability. So during open enrollment, you may you have the opportunity to increase your life and disability coverages. So if you receive this message, the evidence of insurability process must be completed. So you receive this message that you see here on the screen. You'll fill out that questionnaire, and then once you've completed that EOI and coverage is approved by the insurance carrier, then your benefits will be active. But just keep in mind, if you receive that EOI message, you must contact the benefit office for those instructions on how to complete EOI. It's very important if you want to have the correct amount of coverage.
So just to finish up with some open enrollment housekeeping items, changes made during this open enrollment period will remain in place for the full plan year. The plan year does begin on April 1st and will go through March 31st of 2021. Any changes made outside of open enrollment can only be done if it's in line with a qualified life event, such as having a baby or getting married or a loss or gain of other coverage. But any other changes, like we are asking you to go in over the next 2 weeks and confirm your benefits are as you want them for the next plan year. The 1095 tax form is not required again this year, but just so you know, we will house it for you safely in your employee file at icubabenefits.org. But again, it is not required this year, so we will just hold it for you. All other requirements of the healthcare reform are in place, and just as so you are aware, IQUBA plans offer more generous free wellness benefits than are required by law. Now is the time for you to review not only all of your benefits to make sure they are as you want them, but also to update your life insurance beneficiary information. Just as a reminder, when designating a beneficiary under the age of 18, you may want to contact an estate planner or establish a proxy or a trust.
And then that brings us to the end of our presentation. We want to thank you guys for your attention. We are so excited about our upcoming 18th year of continued service to you. We look forward to helping not only you guys, but all of our 27 member schools. That is the end of our presentation, and I think if anyone has any questions, we'll open it up now for you guys to ask any questions.
We've unmuted your line.
We do also have the chat feature here on screen, so I don't know how many of you are at a computer, but that we do have that capability. So.
Yeah, I can do it. What surgery plus what? Yeah, she's asking about surgery plus if you don't get rally dollars for it if you use surgery plus.
That is correct. Surgery Plus is not included in the Rally platform since it is not a part of Blue Cross Blue Shield. The incentive that you receive by going through Surgery Plus is not having to reach your deductible or out of pocket because the whole surgical procedure is done for free to you as the member.
They're on the card. Question about flexible spending. Anybody else? Thank you. Yeah. Oh, wait a minute. Yeah. All the Aflac. Chief? Yeah. Yeah, the question was about canceling current Aflac to enroll with the group.
And do you want us to answer that?
Yeah, she wants to cancel her current Aflac but join the group. Does she have to do anything for informing the current carrier?
So the current Aflac, I believe St. Stephen's School canceled the current Aflac offerings, and you will receive portability notices in the mail. So if you do not want to continue your current Aflac offering, you simply will not fill out that portability paperwork, and you simply elect benefits through the IQBA Aflac offering in the IQBA benefits enrollment site.
Right. Well, you want to select the group benefit and when you do the open enrollment. I think we're done. Thanks, Rachel.
All righty. Thank you very much.
And
Thank
Janelle, thank you. Bye-bye.
Bye, everyone.